So, in that sense, that is the affection. It usually it has some lots of sphere of action and on the basis from head to foot, and we can prescribe on the basis of that. That is the deep-seated aggression, especially on the spinal cord. It acts on the spinal cord, the sympathetic nervous system, even the bones, the urogenital organs, and the skin, mucous membrane, glands, and like this. Even the this is also very important, affecting the glandular affections and also to other all the organs which are very important here. Even all over the body, even the growth is also there, even the mainly the bony destruction, even the congenital effect, congenital disease also to be produced by this nosode. So these drugs also producing some malformation of these respective organs and so on. So next number, if we see the brain, it is a main action on the brain and the nervous system, and producing most of the time it is the brain and nervous as a result of it is producing the paralytic conditions of the paralytic condition of the brain and paralytic condition of the nerves, and there is the trembling and fidgety, and with the loss of the memory, is very important. Okay, so brain symptoms is very important. The spinal cord, brain symptom, the spinal cord, the nervous system, they are the producing the paralytic condition, trembling, fidgety, numbness, weakness, loss of the memory, forgetfulness. These all are also present in case of the nosode. I mean that here. Okay. Second number, the physiological action is there. So whenever you see, it acts on the cardiovascular system. It acts on the cardiovascular system and the respiratory system, and resulting in the dyspnea, the cough, pain, asthmatic condition, and the heart is also involved. It may be the hypertrophy of the heart, a congenital defect, or some other parts, or some other complications. Third number, the it acts on the joints and the bones. So as a result of this, the manifestation are as in the rheumatism or in the gout. So in case of the gout and rheumatism, we must think of it, rheumatism and gout, we must think of it that the glands are also enlargement of the glands all over the body is also another factor. So all the glands are also involved, all the glands are also affected by these drugs and so on. So the glandular inflammation, the uterus and the other uterus and the urogenital organs, especially the males, even the breast and other glands are also involved in it, and so the consequent effects, consequent signs and symptoms also produced by these drugs. Therapeutically, if we see, we will see that if there is any abdominal disorders, the asthma, the cough, the diabetes, the epilepsy, the eye affection, gonorrhea, suppressed gonorrhea, rheumatism, headache, liver affection, throat and lungs affection, mental disorder, urinary troubles, even natural enuresis, nocturnal enuresis, warts, tumor, paralysis are also affected. But these are not the everything. Besides this, there are so many signs and symptoms are also produced by these drugs, provided the signs and symptoms should be the matching and the respective organs are to be affected by these drugs. So again, if we see in case of the Medorrhinum, the causative factor already told me about there is the aggravation, amelioration, causative factor, some damp weather, even the psychotic manifestation, the suppression in any type of is also very factor. So in case of the causation, if we see the causation, we'll get it to some basic idea regarding the nosode and these drugs, and we can prescribe the medicine accordingly. So in case of this Medorrhinum, if we think about the causative factor, we must consider the factors which are responsible for the disease condition and the dyscrasia and the effect of it. Okay, so what are the side effects by this myosome and is produced? That is the first number is the maltreated and suppressed gonorrhea is a very important factor. Maltreated and suppressed gonorrhea. Okay, so whenever once upon a time the person was suffering by ancestors was grandfather, grand, like this, father or mother, not only the father but also the mother are suffering due to this, and the subsequent consequence effect are occurring in generation to generation, we must consider these drugs also. Empirically and directly on the basis of the signs and symptoms and so on. So other medicine are also the Argenta metallicum, Argenta niticum, nitric acid. Nitric acid also the syphilitic manifestations, but Sepia, Staphylococcus, Thuja, Natamsab, these all are organs are maltreated gonorrhea, and as a consequence effect of the effect we can see it. So second number is the history. If we see, there is the history of the gout or rheumatism, history of gout or rheumatism in a family, or neuralgia and diabetes also, disease of the spine, neuralgia, paralytic condition, disease of the spinal cord are also affected. Even the numbness, even any growth of any part of the body, or the glandular affections, even the paralytic condition, even the there is a psychotic manifestation, psychotic action are also there. We can think of the nodule. So whatever may be the in case of the nodule, we must consider the above effects, side effect, and so on, or the causative factor. So somewhere these are the maybe the causative factor, somewhere maybe the modalities, somewhere maybe the signs and symptoms, and somewhere there in the past history. So in that basis, we must consider. Even another thing is the squamous carcinoma. This is also another thing which is also carcinoma or the cancer. When the symptoms point of history of the symptoms point, the history of the psychotic manifestations are there, then we can think of the नोजोल. So psychotic manifestation की हिस्ट्री पहले में होना चाहिए, तो हम तब उस हिसाब से हम नोजोल के बारे में हम सोच सकते हैं. Another thing is that is in case of the women with the chronic salpingitis, chronic vulvitis, chronic oophorytis, chronic pelvic cellulitis, even the uterine any problem or any cyst, another any growth, or with or without the psychotic origin. So if you go through the Allen's keynote, you will find that even the Dr. Allen has told that regarding the nozode, regarding the Medorrhinum, I know better than anyone. उनका एक थोड़ा ये था, whatever may be, उनका हिसाब से बहुत अच्छा लिखा है. जो पुराना एलेंस की नोट है, पुराना एलेंस की नोट, उसमें तो डिटेल्स पढ़ो. मेरे ख्याल में उसके बाद तो लिपि का पढ़ने का, ठीक है ना, बॉडी पढ़ लेना. देन यू गो टू द लिपिज मेटिमेटिका and Medorrhinum also to be studied definitely from the Allen's keynote. Okay, then we are talking from the different books. Even me also, I am taking the help from the different books. Even sometimes I read and discuss in front of you, so that if you get the basic knowledge, once upon a time you hear it or listen, then there will be no problem in the long run while studying the mathematics or while studying the drugs, because of already a basic conception is there, and then it will be easy for understanding, at the same time to read it very easily and in the way of the comprehensive manner you can understand very easily while studying the mathematics. That's why I usually even sometimes I talk from the books also. Even in front of me there is some books are there, from them I discuss this. I read it and I discuss it, because of if you go through the mathematics in details like the puppet, you will not understand until and unless you comprehend it, you realize it, you chew it, and you will digest it. So that's why sometimes we have to talk about this by this method. Okay. So in case of the women, those who are suffering from the psychotic origin or from the cellulitis or wooferitis or salpingitis, even with or without a psychotic origin, then you can think of the this medicine, that is the Nozor, that is the Medorrhinum, and in this way. Next number, if we see that all the medicine, all the drugs, all the the Nozor or all the miasmatic dyschizia has some peculiarity, we can prescribe on the basis of the miasmatic dyschizia. If we see the constitution of the appearance or the mental condition, definitely we get so many clues and help us a lot to make a correct prescription and to study the materia. First, knowledge is to be required, then we can prescribe. If we do not have any knowledge about the drugs and the miasm, then we can properly manage it. We cannot. So appearance, if we see the Medorrhinum is ideally, we can see the Medorrhinum is ideally suited to the patients having a constitutional effect of the man treated or the suppressed gonorrhea, with mostly the Medorrhinum patient have some peculiar symptom, that is the trembling. Okay, so this type of trembling is very important of Medorrhinum, especially found in case of the internal trembling is very characteristic symptoms of the Medorrhinum. Some people says that, Dr. Sir, at the old age or somebody tells that there is some gurgling or rumbling inside my body. Every time there may be some trembling which I feel from inside. I don't know why it is happening, so and so. So we can think of the Medorrhinum in that sense. And simultaneously, the extremities part, numbness is there, and the pain numbness is there, and the paralytic condition or paralysis condition, that is also very indication of the Nozor, especially the Medorrhinum. Actually, Medorrhinum usually affects the nervous system, the central nervous system. As a result of this, is become the weakness, prostration, paralytic condition, and so on. So sometimes we see the old people are mostly prone to this one, and those who are the suffering from the psychotic manifestations and the gout and the rheumatic problem, all even it is very important factor is that the nerves also important, the joints also important, the glands are also important. As a result of the peculiarity is that there is a constitutional changes are there, their characteristic peculiarities are there, and on the basis of that we can prescribe the Nozor, this medicine, that is the Medorrhinum. So Medorrhinum ideally suited to the patients having the constipation effect, a man treated or the suppressed gonorrhea with trembling all over the body, with easily fatigueness is very important, and emaciated result of the continued chronic diseases, long continued chronic diseases there. Most of the time what happened, the allopaths are prescribing on the basis of the symptoms, and then if they repeatedly they are prescribing allopathic drugs, as a result of there is a suppression, as a result of there is a suppression and there, and gradually the suppression by due to the repeatedly suppression, their constitution has been changed, and the patient will becomes very affected, and the collapse will be done. The rickety children with pale appearance is also very important. Rickety children with the pale appearance is also very important. Dwarf is also important. Dwarf. So by birth we will find that some babies are born by the dwarf condition, and then the stunted growth. This is another very characteristic symptoms of the drugs. That is the stunted growth, or the dwarfism is very important to the both in the physical plane or maybe the mental plane, is also very characteristic indication of the Nozor, especially the Medorrhinum and also the Medorrhinum. So mental and physical, dwarfism or idioticness is a very characteristic symptoms of the Medorrhinum. We should not neglect it at any cost. So if there is a history or a family history of the psychotic manifestation there, and having the history of the gonorrhea, as a result of that and the consequence effect of the psychotic gonorrhea, the next generation, next generation, all are suffering. I have seen so many cases are there, and if we trace the psychotic manifestation, in the history of it, then we can prescribe the Medorrhinum. And first, if we give the Nozode, then all other symptoms will be abolished gradually, because we are giving firstly the antipsychotic medicine, and it will help a lot in the long run also. Okay. Next number, if there is any temperament, very weeping disposition, it is very important symptoms of the this drugs is also there. They are very peevish, they are very impatient. If you go through the Alinsky note and Dubé's book, then you will find it has been mentioned that the patient cannot explain their problem without the without weeping. So if you ask to any baby or someone, what is your name, first of them, or where you resides, the first of all they usually weeps first, or crying first, or mourning first, then they will give the answer. This is very peculiar symptoms of the Nozode, especially the Medorrhinum. So Medorrhinum patient first weep, then give the answer. First weeping, then give the answer. This is the Medorrhinum on one single basis prescribed is this like this. Next number, they are very peevish also, and they are the psychotic patient is very much impatient. So the patient usually moves here and there due to the they are not settled in any one place. They are also moving from one beginning to another. So basically, if we see the patient is basically, although there are the psychotic manifestation, but apart from this, there is in the history of the hot, they are actually basically a hot patient inside the hot patient, and affected by the heat in general, in general. So affected by the heat in general, also another characteristic. Next number, if we see the miasm gets in background, the most of the travels is the psychotic is the miasm, but until and unless the suric is there, the psychotic cannot come. So first suric, then psychotic is very important, and third number, there are so many modalities are there which indicates the Medorrhinum in general. Chalo, next number, the miasm psychosis background, and if we see the diathesis, so you will see that in case of the diathesis, there are the scrofulous diathesis and the rheumatic diathesis and the gouty diathesis. So the rheumatic and gouty diathesis is very important to this cases, and we can consider the signs and symptoms. If we see the mental general symptoms of these drugs, then we will find it very characteristic symptoms are also available, and we can think over it. The great hurrying doing the work gets the very fatigue. Usually the psychotic patient, they are very much impatient and they are very much hurried, and they hurried and doing the work very fastly, try to and gets fatigue. Next number, other medicine, Argentiniticum, Sepia, Lachesis, Pulsatilla, Calciraphos, and so on. The time moves too slowly is also another factor of the Nozode. Time moves too slowly. Aluminum, Argentiniticum, Cannabis indica, Alumina, Argentiniticum, and Cannabis indica. So, what will find it? The person, they are having they are usually very slow, and moves slowly. These are medicine having the slowness is also very important factor of the drugs. Next number, if we another thing, they usually very forgetfulness is also there. They usually forget everything what they have studied, even that the previous night. So forgetfulness is also one of the very important symptoms of the Nozode, and especially the Medorrhinum. The Medorrhinum patient very forgetful in nature. They usually forget. They are very close in name of himself, him or her, and another thing, the name of the well-known first friend to them, friend's name or any name, they usually forgets. Even the friend's name, even the place's name of the places, they usually forget. So it is a very important symptoms of the Medorrhinum patient, the forgetfulness and forgetfulness. Next, if we, even that they usually forget their own name also. Okay. Next number, they usually forget that not only their own name but also they forget the a very close friend also there. The losses, even they are usually mostly losses of the thread of the conversation is also very important factor of the drugs. Losses of thread of conversation. Okay. Next number, see that thread of conversation also, and they usually talk constantly. That is also laches. So these are the priority given to the losses of the thread of the conversion and loss of the memory, and this type of loss is very important to these drugs. Next number is the sensation as if all life was unreal. Sure. The sensation as if all the life was the unreal, like a dream. Even this is also another factor of the Medorrhinum, that is like a dream. Usually they think that the whole life is like nothing but a dream. So they do not give them priority to the important things. They think everything will be happen in a chronological order. They even may already bola very uncommon peculiar symptoms of the Medorrhinum is very peculiar, that the patient cannot speak without the crying. One is that there is the pulsatile is also one of the another medicine. Pulsatile one another medicine. Another is the medicine is the lilium tea. So in case of the pulsatile, we can think about it that they usually forgets everything, and they are also weeping tendency before talking anything. They usually weeps or they usually cry. So these are the very important symptoms of the pulsatile, Medorrhinum and the lilium tea. So in case of the lilium tea, all the symptoms are related to the uterus and the heart symptoms. So in that sense, we cannot think of the lilium tea, but very few cases are there, patients are there who usually use the lilium tea very often rather than the these drugs. Okay. Next number, fear of darkness is also another very important symptoms of the Medorrhinum, that is the cannabis indica and the stramonium and the lycopodium. So if there is any fear of darkness, even the phosphorus also having the fear of darkness. Okay, the cannabis indica and stramonium, these are also having the fear of the darkness and so on. Next number, the patients of the Medorrhinum is very much they are the impatient. They cannot stay in a place like that of the sulfur patient also cannot stay cannot remain in one place. So these type of symptoms are also present in case of the soda manifestation. Even not only that, even that the wandering tendency is also very important symptoms of the calciferous and also the tuberculinum. Also the patient, they are also having irritable to the trifles to the bath में irritable हो जाता है and so on. But another thing is that they are the very reserved displeasure. The medicine that is the Medorrhinum, they are the very irritable over the trifles. Next number, another thing is the very selfishness is also very important factor of the Medorrhinum patient बहुत ही selfish हो जाता है. Okay. Next number, melancholy with the suicidal thought is also another factor of the Medorrhinum patient हमेशा क्या करना चाहते हैं ना suicidal thoughts है. हमारे पास बहुत सारी मेडिसिन है which are having the suicidal thought or the impulses. So these type of impulses also present in case of the Medorrhinum and so on. So there are so many drugs are ahead. There is the suicidal tendency, but different type of suicidal tendency also we have to find it. So in case of the Medorrhinum, they are find there is the forgetfulness, and so they are the They think that perhaps they have done some crime. As a result of, they should not stay long in this earth. Sure, they may commit suicide. Even another thing is that there is the suppressing history. So those who are having the suppressing history, they are mostly prone to suicidal tendency. Okay, these are the very miasmatic background, even miasmatic dysphagia is there, and most of the time it has been found that those who are the very psychotic manifestation and these are the suppressed repeatedly, they are prone to suicidal tendencies. Next number is the or suicidal thoughts are there. Next one, mental symptoms are also aggravated while thinking of them. These are also a very important factor, important symptoms of the drug. That is these symptoms are also present so many cases. That is while thinking of it. Oxalic acid is also very much important. Carbonilis is also important, and helonias is also important. Okay, so if we see these symptoms to everyone, the mental symptoms are aggravated when thinking of them is also very important symptoms of these drugs. So next number is the very aggravation when thinking of them. Calcula falsi, the helonias is also there, and the oxalic acid is also there. Next number, anticipates incidentally and incidents even before they occur. So इसलिए एलेंस की नोट में फूड एंड एलेंस की नोट जो है उसमें एक जगह लिखा है that this is also a medicine for astrologer's remedy. So why it is to be called the astrologer's remedy? It means that मेरा बात नहीं, दुबी जी का बात है, उन डॉक्टर साहब बोले थे, दुबी जी बोले थे, they whatever usually predicts that is happening within 3 to 4 days, that is happening most of the time. What it means, it is not a question of the infanticide, but it is a question of the survival. So the treatment, question of the treatment is also important. Next number, that is if we see the physical general symptoms, that is a very important symptoms of the drugs. So we have already discussed about the mental general, the constitution and diathesis, temperament, mental disorder, and the physical general symptoms are also very important also there. So if we see it, the physical general symptoms, the reaction to the heat and cold, that is the Medorrhinum, which is a hot patient, easily affected by the heat in general. Medorrhinum is a hot patient, and especially inside the body there is a hot feeling, hot flushes. This is very important. Next number, easily affected by the heat in general. Medorrhinum patient in general they are affected by this heat in general, and also there is in general there is a very important signs and symptoms of the drugs. So Medorrhinum hot patient, somebody told that it is highly chilly, but there is the anticipates incidents and even before they occur, that is the Medorrhinum. So Medorrhinum का क्या होते हैं, astrologer से कभी इसको बोला जाता है. Whatever they usually predicts, that is also comes true in the life. That is a very important symptoms of the Medorrhinum. जो भी बोलते वो हो जाता. इसलिए इसका astrologer remedy सबसे इनको बोला जाता है. Next number, Medorrhinum patient is affected by the heat in general. Desire for the alcoholic drinks is also very important. Laceram, like I say, snacks, and other drugs are there. They are very fond of the green and icy food. Okay, that is the Medorrhinum is also another symptoms of the drugs. That is they prefer the fruits also. They prefer the sweet also. Okay. They prefer the oranges, they prefer the salt things, I mean the argentinite and carbohydrates, lactanamule, sour, khatta seed, sweets they prefer very much. Even they prefer drinking water is very important symptoms of the drugs. So sweets preference is also symptoms of the argentiniticum, the China, lycopodium and sulfur. So in case of the छोटा बच्चे का sweet aggravation है, sorry, sweet aggravation at the same time क्या बोलते हैं amelioration, we can think of the Medorrhinum also. हमेशा ऐसे नहीं है जो sweet aversion होते हैं, ऐसे नहीं है. They prefer the sweet, even very strongly they prefer the sweet. Okay, like the Argentinitica, lycopodium sulfari also there, C9 also there. But the lycopodium, what happened in case of the lycopodium, they are both craving for the sweet and the salt, both are there. C9 also very craving for the sweet things. Even the Argentinitica also, there is the sweet of the sweet Argentiniticum, China, lycopodium and sulfur is also very important for they are also having the excessive craving for the sweet, and whatever they dislikes, they usually done thing everything. Next number, they sleep, no knee elbow position. It is also very important factor of the Medorrhinum patient usually prefer to lie on the knee chest position. Okay, जैसे जिसको बोलते हैं कुत्ता जैसे सोते हैं, dog's position. So if we see the knee chest position like this, even in case of the asthma or any respiratory travels or any heart travel, if the patient is in this so knee chest position, then we can think of the Medorrhinum. This is very characteristic symptoms. Even in case of the one symptom basis, we can prescribe the Medorrhinum. Knee elbow position lies on the abdomen. Shina kya karta lies on abdomen, that is different. And knee elbow position is to some extent different. Okay, देखो ना कुत्ता जैसे सोते to some extent, हाथ पर ऐसे करके ऐसे सो जाते हैं, crawling करके. That is the knee elbow, knee chest position, and the lies in abdomen, back with the hands on the head. So sometimes they usually prefer to lie on the head with back of the head, with the hand of the head, and very wakeful, sleepy towards the morning is very important in this time usually. So wakefulness, wakefulness, sleepy towards the morning. इसलिए जो भी सुबह सुबह उठ जाते उसके लिए कुछ wakefulness, sleep during morning and during the great restlessness at night, sleepy but cannot sleep. इसलिए sleep में जैसे देखते हैं knee chest position, elbow position, knee elbow position, and lying on the abdomen, these symptoms are very present. But at the same time, there will be wakefulness, sleeplessness usually at night. Okay, and sleepy but cannot go to sleep. There is a restlessness in the bed is there, but they cannot go to the sleep. This is very uncommon symptoms of the drugs. Next number, if we see the sweat, so in case of the sweat, there is the cold sweating during the collapse stage. So cold sweating is also very important during the collapse stage. If we see the dreams, sweat about the dreams, you will find it dreams of the dead body. Okay, so बहुत सारी मेडिसिन है, आर्सेनिक है, मैगकर्ब है, थूजा भी है, लैकिसिस भी है, dreams of the dead persons. This is another very characteristic symptoms of the Medorrhinum, where you can see that in case of the dreams, the patient Medorrhinum is the topmost level, and dreams of the ghost, the old person, or those who are working in the institute, or those who are the very on the dead dreams. आप कौन मेडिसिन है? Arsenic is also another medicine, magnesium carbonate is medicine, thuja is also medicine, dreams of the dead body even after death also, that is it. Even sometimes the dead body may be common to some persons during the dream, but sometimes it has been seen that in thuja and Makar also having that. Even sometimes they usually have some fear about the God. They think that the God is there or the angels is there. During the dreams also, they see the ghost, they see the God, even that they see their respective Devi, Devata, like this. Okay, they are very much frightful, and the ghost spectators are Medorrhinum, and carbon is also there, and the gravities, and these symptoms also, the dreams of the so and so, and also relief. Next, thirst, constant thirst. There is the constant thirst, even in the dreams is the drinking. The in case of the Medorrhinum patient, they usually excessive thirsty. They so thirsty that few liters of water they may consume within few hours also. So, in case of the Medorrhinum patient, especially this physician, and that is the Dr. Honeyman has seen that there is the constant thirst for the dreams. He is drinking. Another thing is appetite. There may be the ravenous appetite immediately after eating. Shina and the Sorenum is also one of the factor. Shina, so they dreams of hunger. Shina, Sorenum, and lycopodium is also very important factor. Where you see they usually prefers the this type of food and drinks and sleep and so and so. If we see in general, that is the aggravation. So if we see the aggravation, then we will find it. The in general aggravation of the, it is very peculiarity is there of these drugs is that is the whenever thinking of it is also aggravation time. So in case of the aggravation, we will find it that aggravation while thinking of it, that is the calcinephos, helonias, oxalic acid. These are the drug symptoms are there. Okay. Next number, that is the heat in covering. So heat in covering is also very important factor of the drugs. Okay. So whenever thinking of it is also helonias and the oxalic acid, heat and covering is also aggravation time of the Medorrhinum is also heat and covering. So sometimes they are the chilly, but they can tolerate the heat. Heavy hand, they are the psychotic manifestation. Usually psychotic manifestation are the chilly patient. Okay, and the things is that is the aggravation from the heat. Be also there, covering be also stretching is also aggravation. That the thunderstorm is also very important. Even the thunderstorm you will find it. Some other drugs is also there. The natrum, phosphorus, rhododendron. These are the medicine for the aggravation from the thunderstorm is there. Least movement is also very important of the Medorrhinum, and another is the sweat also aggravation by the sweat from day night, and from daylight to sunset, that the aggravation time, reverse of the syphilinum. So Medorrhinum the patient mostly aggravation during the daytime, okay, but syphilinum aggravation usually night. So Medorrhinum the psychotic manifestation ka the aggravation time is there, that is the mostly from the sunrise to sunset. So psychotic manifestation ka aggravation mostly from sunrise to sunset, whereas the syphilitic manifestation ka aggravation time is sunset to sunrise. So this is the basic difference between the two drugs, and whereas the psychotic soric acid, both the daytime and nighttime. So day and night, like the pendulum mapping, that is the aggravation and ambulation to some extent like that of the soric manifestation, like the pendulum mapping. Din may be aggravation, not may aggravation. Whereas in case of the psychotic, that is the daytime aggravation between the usually daytime. So these are the very important factors. Syphilitic night aggravation. These are the very characteristic symptoms. So next number is ambulation. Very peculiar symptoms of the ambulation in case of the Medorrhinum is ambulation in the open air and ambulation in the seashore. So in case of the seashore emulsion, this is very uncommon regular symptoms of the drugs. Usually seashore emulsion, बहुत कम मेडिसिन में है. Whereas of course we have the medicine, seashore high altitude emulsion, high altitude aggravation, and seashore aggravation. These all are having the symptoms. So emulsion in the seashore, reverse of the Nigeria, reverse of the natremia also there. So at the seashore, that is the emulsion. Most of the time it has been found that the heart problem or the asthmatic problem, heart problem and asthmatic problem is also relieved the Medorrhinum cases, and natremia also aggravation from the seashore. Natremia the aggravation from the whereas Medorrhinum is also emulsion. Okay. Next number, lying on the stomach is also very important. Medorrhinum patient always lie down like this position, lying on abdomen, like the sulfur, like the sina, like the sternum metallicum, and Medorrhinum also. So another thing is also the damp weather aggravation, that is also the causticum, and naxmica is also there, and so on. Next number, if we see the great, that is the great peculiarity symptoms are there. That is the great heat and the soreness with the enlargement of the lymphatic glands all over the body. The guiding symptoms is very important, and if we see the guiding symptoms, we will see the great heat and soreness with enlargement of the lymphatic gland all over the body is very factor. So heat and soreness with the enlargement of lymphatic glands all over the body is very important symptoms under the guiding symptoms. Okay, so soreness, heat and soreness with enlargement of the lymphatic glands all over the body, all the glands are enlarged and the lymphatic glands are enlarged and so on. There is the trembling all over the body is also very important factor. Already I have told you that the internal trembling is there, which is not, that is also a subjective that is a trembling. The patient usually complains about the subjective trembling, the intense nervousness and profound exhaustion is very important factor. So along with it you show the intense nervousness and profound exhaustion is very important in case of these drugs. Next number is the pains or arthritis. So in case of this is also a rheumatic patient or the gouty patient. So what will find it? In case of the rheumatic patient, we'll see the arthritic problem. Okay, see the arthritic problem, rheumatic problem is a sequelae of suppressed gonorrhea. So in case of the gonorrhea, if it is suppressed, the consequent effects will be continued for generation to generation. So if we see the suppressed gonorrhea, the उसका जो sequential उसका जो effect है, that will be carried forward by the generation to generation, and so many so many generations will suffer it. So if somebody has done some crime or some mischiefs, so if it is to be suppressed by any means, it may be by medication, by externally or injection, but the blood becomes complicated. The blood, the gene, the cell, all are becomes affected, and they will produce the sign symptoms. So we see there are so many patients, those who are having history of the suffering from the maltreated gonorrhea, their generation are suffering, generation to generations, persons are suffering due to that of the suppression of the or affection of the gonorrhea. ठीक है ना? इसलिए इसका पीछे जो इतिहास है, इसलिए होम्योपैथी में इतिहास देखना जरूरी है. The past history, the present history, that should be in detail. So if you go in details, the root cause of the disease condition, then only you can find it. Otherwise, no. Otherwise, not. So always I tell you that be optimist, and these type of cases, if you very minutely observe, even their behavior, attitude, and the constitution, their mentality, even their desire, aversion, signs, symptoms, everywhere the sign, the medicine is to be inherited, or the medicine is to be hidden. So the keen observation is very important. Okay, and proper study, proper knowledge is also very important. Next number. So pains in arthritis, so trembling all over the body, subjective and intense nervousness, and profound exhaustion is there. Pains are arthritic and rheumatic. Sequelae of the suppressed gonorrhea is there. So suppressed gonorrhea, constricting feeling is also there, seems to be tighten the whole body. So इसलिए हम क्या देखते हैं, gonorrhea constricting feeling, and that is also present in case of that is the teaching anacardium and the cactus grandiflora and so many medicines. The seems to be tightened the whole body, as like the whole body is to be tightened. Next number is the sore all over the bruised feeling. Even the patient most of the time they complain their very bruised feeling of their, even as if somebody is to be beaten, or like that of the arnica montana and the euphasia and eupaturum perpunctum is there. So if you see it, that is the Medorrhinum. So we will find that there is the aggravation and so on. So state is very important. Another, the state of the collapse is very important, especially in case of the cholera stage. So whenever well selected remedy fails, that we can think of the Medorrhinum, even in spite of the arsenic, the Apis mellifica, the camphora, the arsenic album, and other drugs will fail. If there is a history of the past history of the psychotic manifestation or the gonorrhea is there, we can think about it. Okay. Next number, state of collapse wants to be fanned all the time. Carbamide also is a very important factor of the that is that they want constantly fanning and so on. Craves fresh air, that is also very important on the drugs, and the skin becomes very cold. Yet throws up the covers, there is a very important on the Medorrhinum patient, but also this type of symptoms also present some other drugs. One is the camphora, another is that is the cecal cord. Okay, so the patients are somewhere, the hot patient. Some told that as they are the rheumatic patient and gouty constitution, so they are the chilly patient. Whatever maybe, we should not go into the controversy. Every physician, every teacher, every writer, they have explained in their own way. So we should study all of them. We should listen all of them, but the judgment of it, because of who has given every teacher has given their traces in his own angle and prescribed and given and included into the Mathematica or the clinical Mathematica, but whatever may be. So the craves, fresh air, skin cold, yellow throats of covers, camphor shaken and cold, and bath with a cold perspiration is also the Veritrum album is also very important. Veritrum album having some profuseness is very important. Everything is discharges are profuse and unlimited is also there. So these are very important factor of the this. Next number, burning of the hands and the feet are very important, like the sulfur and other drugs, Apis, Chamonuria, lacacious like this, Medorrhinum and Surinam and so and so. Even the Sina is also there. So burning of the hands and feet is also very important medicine, important symptoms of the Medorrhinum, and once them covered and fanned, that is also very important symptoms of the Medorrhinum. So although they are the burning, but they wants to be and them uncovered and fanned. They wants to be uncovered and fanned That is also another characteristic symptoms of the Medorrhinum. The other medicine is the laxation and the sulfur. There is the burning sensation of the hands and the palms and soles are also there. Okay. Next number, if we see another factor, that is the head. So if we see the head and throat, so intense burning pain in the brain is also there. Intense burning pain in the brain is also there. There are also aggravation in the cerebellum, burning pain in the brain, aggravation in the cerebellum. They extends down to the spine. Okay, the pain also extends down to the spine. The head feels heavy and is drawn backward. This is also the head feels heavy and drawn backward like this way. The in case of that is the episthotonous condition, that type of headache, and they feels better in like this, which is also very important symptoms of these drugs. Show intense burning pain in brain, aggravation by cerebellum, extend down to the spine, head feels heavy and drawn backwards, sensation of the tightness and the constriction is also another symptoms of the Medorrhinum. So it is a contractions of the head feels heavy and drawn backwards, sense of tightness, a contraction extends down to the whole length of the spine. ऐसे लगता है जो कोई तो भी नर्वस सिस्टम है स्पाइन से जो बैक पोर्शन नर्व्स जाते from central nervous system, that is the drawn, that is the dragging type of pain, that is also present. That is the laxation and sulfur is also there, and down to the whole length of the spine. Headache and the diarrhea from jarring of the cars is also very important. So headache को साथ कहते हैं jarring of the cars. So especially कोई को लोगों को headache देखा गया है while traveling, ठीक है ना, traveling headache. हमारे पास पॉपुलर सिंडिका तो एक मेडिसिन है, पेट्रोलियम भी है, नाक्स मस्टर्ड भी है, while traveling the any one place and so on. But और क्या देखने का जो that taken a severe headache with from jarring of the cards, throat sensation. Another throat symptoms is also very important of the drugs. So this is also very peculiarity of the drugs is there. Sensation as if the head taken a severe cold with a distressing aching in the bones. ऐसे लगता है उनको वैसे लगता कोई तो the sensation of the head has taken a severe cold. As a result of distressing aching in the bones, और साथ क्या बोल दिया? Aching pain in the bones, headache के साथ aching pain, or throat complaint के साथ aching pain in the bones. So here the nervous system is also affected, and simultaneously the bones are also affected, the glands are also affected, the urogenital organs are also affected. Okay, so the distressing, those sore throat and swollen. There is the sore throat and swollen, and the deglutition of either liquid or solid impossible. So the patient cannot deglute the liquid and the solid at a time, because there is the pain in the region of the throat is also there. Next number, throat constantly filled with the thick and the grey or bloody mucus is there. So हम ये भी देख लेते हैं the throat constantly filled by the bloody mucus and the grey or the bloody mucus and flowing from the posterior nerves is also there. So ये जो bloody mucus है from the posterior nerves, उससे ऐसे लगता है कोई ये हो रहा है mucus आ रहा है, deglutition, throat में pain होते हैं, and constantly the mucus are flowing from the posterior nerves and here also. And but other medicine also, this throat problem must consider. The laxity is also there, even the Barata are also there, even the Kali group also there, Kali carb also there, even the hydrosis is there. So we can distinguish these medicine from one after to another on the basis of the signs and symptoms and the modalities. So in case of the throat, the sensation of the severe cold is there, distressing, aching pains in the bones, throat are become sore and swollen, deglutition of either liquids or the solid impossible, the throat constantly filled with the thick gray or the bloody mucus. So throat is covered by the thick gray or bloody mucus covered with the fluid from the posterior nads is very important. So from the posterior nads, if there is any throaty problem, we must consider that is the hydrostasis. Hydrostasis also having the important signs and symptoms of the throat, and the discharges are yellow and the stringy like that, stingy like that, mark bhivas like this, and the kali bichromicum like this discharges are there. Okay, thank you. We'll see the next part. Today portion is over.